All right, so today I'm telling you about a project that we did at Southern Cross University Health Clinic called Expanding Clinical Training Capacity in Aboriginal Health. And how this came about was that I was speaking with one of the professional experience lecturers, Michael Grandy, who's one of the collaborators on this project. And he was telling me, we put undergraduate nursing students with our practice nurses in our clinic. And we were just having a general discussion. He was saying that he had no specific Aboriginal health placement. And I was saying to him, that's really interesting because I was newly joined the clinic as the senior nurse / practice manager. And I said, I noticed that we've got this group of people that are identifying as Aboriginal and Torres Strait Islander, but we're not doing anything with them. We're not doing targeted health promotion and health assessments. So we wondered whether we could do anything with that. So we thought up this project, and the aim was to develop an Aboriginal and Torres Strait Islander nurse-led clinic at Southern Cross University Health Clinic to service the health needs of the local community and act as an outreach for the local AMS, which is Jellums. And the whole purpose was also to increase undergraduate student clinical placements in Aboriginal health. So what we wanted to do was obviously service the health needs of our local Aboriginal and Torres Strait Islander community, increase the placements for students, and also enhance clinical training skills for the clinical teachers delivering. So I was able to successfully apply for some funding to send our nurses on a clinical teaching and supervision course at Southern Cross University, so that they were appropriately trained to teach the undergraduate students and also to connect with our local AMS so that they could provide some education for us as well. So what we decided to do is to establish a weekly clinic, and at the moment that we do one session a week, so that's a morning, and I give my nurses some allocated, dedicated admin time to sorting out their database and contacting their patients. And that is the management and the coordination of care for existing patients, and also to act as an outreach for Jellums if required. So the Aboriginal Medical Service has GPs working for them, but they also work in other general practices across the region. So it was just really to reach out and say, look, we've got some GPs here and some nurses that are really committed to Aboriginal health, and if you ever get stuck with your not having GPs or anyone available, we're open for you to send patients across this way. It was to be for a student placement, and as mentioned, appropriate training of the student facilitators and teachers. So as mentioned for the project Rationale, there was no placement for Aboriginal and Torres Strait Islander, for an Aboriginal Torres Strait Islander placement on the north coast of New South Wales. It was a great opportunity to collaborate with services, so Southern Cross University Health Clinic, the professional experience team, and also the local AMS. We wanted to provide staff education, and we wanted to increase service provision for Aboriginal and Torres Strait Islander populations out of this project. So I understand that this has been updated recently, and this is a bit of an old PowerPoint. But we used the National Guide from the RACGP to preventative health for Aboriginal and Torres Strait Islander people, and we also looked at the Aboriginal and Torres Strait Islander Health Plan. They're two documents that really underpin the work that we were doing in this clinic. So the benefits so far of running this nurse-led clinic was the partnerships that we formed, the increased placement opportunities, and it was also an opportunity to develop the future workforce, so for graduate students in the Aboriginal health arena, so not only primary healthcare but also Aboriginal health. And we were able to upskill and educate the staff that were working in the primary health care setting, where previously they hadn't had any training. So it also needed to be sustainable. So the two members of staff have now completed their unit in staff clinical teacher training. We run the clinic weekly, as I said, a morning a week, but we also allow the patients to drop in opportunistically. We understand that as well. The students that attend the clinic are supported by the professional experience lecturer. The RNs are employees of the clinic, so we haven't had to employ anybody into that role. And our GPs have experience and an interest in Aboriginal health. At the time that we set this up, we had a GP that had just come to work with us from Redfern AMS, and we also had a GP that had moved from Coraki who had a large Aboriginal and Torres Strait Islander base. And then we were able to also offer Closing the Gap and health assessments which would provide further income to the clinic. And we're a fully bulk billing clinic, by the way. So as mentioned, the nurses have now completed their postgraduate level clinical teaching and supervision unit, and they're highly supported. The collaboration has helped break down barriers between AMS and non-AMS facilities. Our staff are now appropriately trained, competent and confident, and they're the current staff running the clinic. So these numbers have increased, but at the beginning of the project, I think there was about 110 patients that we identified as Aboriginal or Torres Strait Islander, and that was from doing our PenCat database search. And previous to the project, there were absolutely no CTG registrations and no Aboriginal or Torres Strait Islander health assessments, and no coordination of care. Now we have 52 patients registered for Closing the Gap and that have completed a health assessment, and it's now been over $11,000 that we've generated in practice incentive payments, where previously the practice wasn't receiving anything, and as a bulk billing practice we really did need that for sustainability as well. So this has been going for over 18 months now, and we've got students that are placed as in the clinic as a health placement in Aboriginal health. We've now got coordinated and focused quality care for our Aboriginal and Torres Strait Islander patients. We've got the financial incentive as well, which helps for the sustainability, as I've mentioned. And also for the students, they're exposed to the needs of a specific population group, which is they weren't getting in their undergraduate placements locally. Our staff are appropriately trained, and it's been a really positive collaboration that has continued between the AMS, the School of Health and the clinic. So we're going to continue because it's working. We're continuing our partnerships. There's opportunity for further research or an evaluation of this project ongoing, and we're able to continue to provide coordinated high quality patient care and clinical supervision to our students. And the next steps from here are to employ an Aboriginal health worker to continue with these clinics, but overall it has been positive and it's been embedded now for 18 months. And that is it. Thank you.